Well, that's a big question because we're learning more and more literally every week about the biochemical changes that are occurring during fasting. But we can simplify some of the general things quite easily. Number one is during water-only fasting, the body preferentially mobilizes visceral fat. If you look at our study where we used a DEXA scanner and we tracked a large number of people through fasting to look at what happened to their body composition, we found that they lost weight, and some of that weight was fat, and some of it was visceral fat, some of it was protein, some of it was fiber, some of it was glycogen, some of it was water. When they come off the fast, they regain water, fiber, glycogen, and protein, but not fat. These patients continue to lose fat, and preferentially visceral fat. The ratio of visceral fat loss to adipose tissue is actually 3-to-1. So even though visceral fat makes a relatively small percentage of the overall adipose tissue on the body, it's a very important part because it's associated with many of the metabolic changes that are associated with the diseases. And so although a person might have lost, say in a 2-week fast, 20% of their total body fat, they could lose 50% or more of their visceral fat. And so there's a recalibration. And then when you look at people after recovery, they've put a couple pounds of glycogen back in their muscles, they've rehydrated, they put fiber back into their gut, they've regained lean tissue. In fact, at the end of 6 weeks of follow-up, the average patient had a higher lean tissue percentage than they did at baseline. So they actually regained their lean tissue and more, although their percentage of fat and visceral fat continued to drop down. Even as they're gaining weight on the scale, they're continuing to lose fat. Bone mass in this study showed there was really no change in bone mass, despite the fact that you might be suspicious of the pathology of bed rest, where people are resting during fasting, that they might have some bone loss mass, but they don't. They maintained their bone mass, they lost fat and preferentially visceral fat and regained their water and hydration and protein.
Fascinating. So it really seems like, basically boiled down, it's almost like a reset for the body, right? Like we're just kind of...
It's like if you take a corrupted hard drive on a computer and you know, sometimes you just turn the thing off and you turn it on and you may not know exactly why, but now it starts working again. It seems like that's kind of what happens to the body in fasting. You get kind of a recalibration. And we know that's happening on multiple levels, including on the microbiome, that there's changes that are occurring in the microbiome. We did a study actually 6 years ago with Luigi Fontana from Washington University, where we looked at microbiome alterations before fasting, after fasting on a follow-up. And the very first paper in a series just came out in Lancet preprints just a couple weeks ago, looking at some of these cardiometabolic changes, and the future papers will be looking at these microbiome changes that occur with fasting.